We also believe that since this is such a huge problem, it's going to take a multitude of solutions. And two of the solutions that we're proposing today are these, that the legislature legalize fentanyl strips. There's strips of paper that can tell people whether fentanyl is in a product or not. This is a harm reduction program, harm reduction measure that really makes sense. Recently, two states, Wisconsin and Georgia, a blue state and a red state, have both enacted this. This should not be a partisan issue. This is a public health issue. This is a harm reduction issue. So we think that fentanyl strips should be approved and should be used by addicts if they don't get into treatment. But remember, treatment is by far the better alternative. And then there's another aspect here that is worth considering in my view anyway. That is that we have this great relationship with the University of Iowa hospitals. Dr. Clancy and Dr. Lynch have just been working incredibly in the MAT area and with us and advising us. What Dr. Lynch said is that if she or someone tells a person who's addicted that they should use the strips, it's a message to them that someone cares about them, that their life does matter, and that's an important factor. The other thing that we're proposing, that I'm proposing today, is that greater use of naloxone and Narcan in this sense, that now people have to get it from a pharmacy. But we think that should be opened up to some nonprofits and other organizations, maybe government organizations as well, that can distribute naloxone and Narcan is the brand name to people and obviously to addicts and their family, because this product can save people's lives. It's the antidote that people in law enforcement and public safety and emergency areas, emergency personnel can administer to people after they overdose and literally save their life, bring their life back. So we want to have wider distribution of that in order to save lives. Again, there's no one thing that's going to solve this problem, but pieces of different solutions are going to really make a difference. So that's sort of where we're at, a little bit of how we got here. It's really a two-pronged effort on our part in the Attorney General's office. One is with prescription drugs, the original purpose to try and do prevention there and do drug treatment there. But also, this emergence of this fentanyl scare and series of deaths is something we and people in law enforcement, public health really want to focus on and think that it's important that we focus on it. With that, I want to turn it over to my colleague in law enforcement, Sheriff Paul Fitzgerald, the Sheriff of Story County. Paul has been a friend and an ally of our office for a long time. He has a brother, Mike Fitzgerald, that's a close friend of mine as well. And Paul, you've had just a remarkable career in law enforcement. You've been president of the National Association of Sheriffs, among other things. Thank you for joining me and go ahead with your thoughts and comments on this.
Well, thank you, General Miller. First of all, I would like to thank you for taking the lead on this. This is truly a very serious crisis, not only in Story County or in Iowa, but throughout the entire nation. To give a little bit of understanding, in 2011, there was 4% of the opioid overdose deaths that had been laced with fentanyl. In 2019, we found that 51% of the overall overdose deaths have been laced with fentanyl, such as 36,000 laced with fentanyl out of 70,630 deaths. So that's, we believe, is quite serious. We had the Central Iowa Drug Task Force, which involves Story County, Boone, and Greene County, and we had a search warrant about 4 years ago, and one of our officers was exposed to fentanyl and went to the hospital. We've had people in our booking that when people were brought in, they've been exposed to fentanyl, and again, requires a trip to the hospital. This is very serious stuff, and it doesn't take much at all. In Story County and the Central Iowa Drug Task Force, we've had 10 overdose deaths. 3 of those, or I'm sorry, we had 10 overdose cases. 3 of the 10 were overdose fatal instances. And of those 3 that were fatal, all 3 were exposed to fentanyl. So we at Story County Sheriff's Office and Central Iowa Drug Task Force, we strongly support the effort of what you're doing here by making the fentanyl test strips legal and getting them out of being classified as drug paraphernalia. This will open things up and help save lives. We strongly believe this. This will allow the user to be able to either test the batch they have, and if fentanyl is present during that, they can at that time choose a different batch. They can use less of what they have. They can have the option to have others there when they use it, or have Narcan available. These are some of the things that we think will help save lives by the use of the fentanyl test strips. So again, Tom, we thank you very much for taking the lead on this, and your efforts are very much appreciated. And we will continue to work with the Attorney General's office and with you through whatever crisis we come across.